You wake up, your mouth feels like cotton, your tongue sticks to the roof of your mouth, and you reach for a glass of water before you've even fully opened your eyes. Most people do exactly that, drink some water, and move on with their day without giving it another thought. I want you to stop doing that today, because morning dry mouth, when it happens consistently, night after night, is one of the most overlooked warning signals in the entire human body, and it can be pointing to something happening in your lungs, your blood sugar, your immune system, or your kidneys, long before any other symptom shows up. I am Dr. James Parker, and I need you to understand something about saliva that almost nobody thinks about until it's gone. Saliva is not simply water sitting in your mouth. It's an active, protective fluid doing 4 distinct critical jobs in your body every single hour of every single day. And when saliva production drops, all 4 of those jobs get compromised simultaneously. Today, I'm going to walk you through exactly what those 4 jobs are, what happens when they stop working properly, the most common hidden cause behind persistent dry mouth that almost nobody considers, and a specific list of warning sign combinations that can point you directly toward what's actually going on inside your body. By the end of this video, you're going to look at that dry mouth feeling completely differently than you did 5 minutes ago. Before we get into the 4 jobs of saliva, I want to be clear about the distinction that matters most in this entire video. Occasional dry mouth from a stuffy nose one night or 1 glass of wine too many isn't what we're talking about today. This is specifically about persistent, recurring morning dry mouth, the kind that shows up night after night as a genuine pattern, because that pattern is what turns an ordinary inconvenience into a real signal worth investigating. Let's start with the first job of saliva, and this is the one I find surprises people the most. Saliva protects your lungs. Saliva contains natural antimicrobial substances that continuously help control the population of bacteria living in your mouth, keeping harmful bacterial growth in check as a baseline function throughout the day and night. Here's the part almost nobody knows. During sleep, tiny amounts of fluid from your mouth can make their way into your airway through a process called microaspiration, small enough that you're never aware it's happening, but real nonetheless. When your mouth is properly hydrated with healthy saliva, this microaspiration carries a naturally controlled bacterial load. But when dry mouth sets in, harmful oral bacteria can increase significantly, since saliva's natural antimicrobial control is diminished. That means the small amount of fluid making its way toward your airway overnight is now carrying a meaningfully higher bacterial burden than it should be. Over time, and particularly in older adults, this connection has been linked to an increased risk of respiratory infections, with pneumonia specifically being the concern doctors watch most closely, since it disproportionately affects older populations and can become serious quickly. The second job of saliva is helping you eat and get proper nutrition, and this one has a ripple effect that often goes completely unnoticed until real weight loss has already occurred. Saliva actually begins the digestive process right in your mouth through enzymes like amylase that start breaking down carbohydrates before food ever reaches your stomach. Beyond digestion, saliva plays a direct, practical role in tasting food properly, chewing efficiently, softening food into a texture that's comfortable and safe to swallow, and completing the swallowing process itself smoothly. When your mouth is chronically dry, these everyday mechanical functions become genuinely difficult, and here's the pattern I see constantly in my older patients. Rather than fighting through the discomfort of eating harder, drier, but often more nutritious foods like raw vegetables, whole grains, or lean meats, people with dry mouth naturally gravitate towards softer, easier to manage foods, which are very often more processed and less nutritionally dense. Over months and years, this gradual shift in food choices, driven entirely by mouth comfort rather than any conscious dietary decision, can lead to unintended weight loss and genuinely poor nutrition, a pattern that's frequently misattributed to appetite loss or general aging, when the root cause is actually sitting right in the mouth itself. The third job of saliva is controlling harmful mouth bacteria more broadly, beyond just the respiratory connection we already covered. Your mouth naturally hosts an enormous, diverse population of bacteria, and saliva plays a central role in keeping that population in a healthy balance. When saliva decreases, the balance shifts, and specifically, the bacteria associated with gum disease and tooth decay tend to increase disproportionately. This creates a genuinely concerning secondary effect. As gum disease progresses, gums become inflamed and prone to bleeding, and that bleeding creates a direct pathway for oral bacteria to enter your bloodstream, no longer confined to your mouth at all. Once in the bloodstream, research has explored possible connections between oral bacteria and several serious conditions, including infections of the heart valves, worsened diabetes control, and there is ongoing research exploring potential connections to Alzheimer's disease as well. I want to be very careful and precise about that last one specifically, because the Alzheimer's research at this point shows an association, a pattern researchers have observed, but it does not prove that oral bacteria cause Alzheimer's disease, and it would be misleading to present it as settled, definitive causation. What is well established is the broader concern that declining saliva allows harmful oral bacteria to increase, which meaningfully worsens oral health and creates a realistic pathway towards systemic complications elsewhere in the body. The fourth job of saliva is protecting your teeth directly. Saliva continuously supplies minerals to your tooth enamel and works to neutralize the acids produced by bacteria and by acidic foods and drinks throughout the day, acids that would otherwise steadily erode enamel over time. When saliva production falls, this constant, largely invisible protective process weakens considerably. This is exactly why I see patients who have maintained genuinely excellent dental hygiene for their entire lives, brushing, flossing, regular checkups, everything done correctly, suddenly develop rapid, unexpected tooth decay later in life. It isn't a hygiene failure. It's the loss of saliva's mineral and acid neutralizing protection, a factor that has nothing to do with how well someone brushes their teeth and everything to do with what's happening at a glandular level inside their mouth. Now that you understand what saliva actually does, let's talk about the most common underlying cause of persistent dry mouth, because it's one that hides in plain sight in almost every medicine cabinet. Medications. A very long list of common prescriptions and over-the-counter drugs list dry mouth as a side effect. And the list includes blood pressure medications, antidepressants, antihistamines, diuretics, often called water pills, bladder control medications, and sleep aids. What ties many of these together is a category called anticholinergic medications, drugs that block a specific neurotransmitter involved in numerous bodily functions. Saliva production very much included among them. Here's the concept I most want you to walk away with from this entire video, something I call combined anticholinergic burden. Many people over 60 aren't taking just one medication from this list. They're taking 2, 3, sometimes more, each contributing its own individual drying effect. Even if no single medication feels particularly strong on its own, the cumulative combined effect of several anticholinergic medications taken together can produce genuinely significant, persistent dry mouth, one that feels mysterious and unexplained until every medication is actually reviewed together as a complete picture rather than individually. Now let's move into something genuinely practical, a set of specific warning sign combinations, because dry mouth on its own is a starting point, but dry mouth paired with a second specific symptom can point toward a much clearer answer about what's actually going on. If your dry mouth shows up mainly in the morning specifically, rather than throughout the entire day, this pattern often points toward mouth breathing during sleep or sleep apnea, particularly if it's accompanied by snoring or a persistent sense of exhaustion during the day, despite what feels like a full night's sleep. If dry mouth is paired with frequent nighttime urination, waking up multiple times to use the bathroom, this combination can indicate elevated blood sugar, and this is specifically worth raising with your doctor as a reason to check an A1C test, which reflects your average blood sugar over roughly the past 3 months. If dry mouth is paired with gritty, dry, or irritated eyes, this combination can suggest an autoimmune condition called Sjogren's syndrome, a condition where the immune system affects the body's moisture-producing glands, mouth and eyes both included. If dry mouth comes with a metallic taste in your mouth or breath that carries an unusual ammonia-like odor, this combination can point toward kidney function concerns worth investigating with your doctor. And if dry mouth is paired with cramping in your legs or feet, particularly if you're taking a diuretic or water pill, this combination can indicate an electrolyte imbalance, since those medications directly affect your body's mineral balance alongside their fluid effects. I want to address something directly because it's the instinct almost everyone has the moment they hear about dry mouth. Just drink more water. Water absolutely provides real, immediate relief, and staying hydrated matters genuinely for your overall health. But water is not a substitute for saliva itself, and this distinction matters more than people realize. Saliva isn't simply water. It's water combined with specific proteins and minerals that actively coat and protect the surfaces of your mouth, providing the antimicrobial, digestive, and enamel protecting functions we spent the first half of this video covering in detail. Drinking more water can ease the physical discomfort of a dry mouth, but it does nothing to restore those specific protective components, and it does nothing to address whatever underlying cause is suppressing your saliva production in the first place. So the message here is genuinely important. Stay hydrated, absolutely, but don't assume dehydration is the actual root cause simply because water provides some temporary relief. Let's move into what I actually recommend. Starting with a simple morning dry mouth check, you can begin doing tomorrow. Pay attention to how much saliva is actually present in your mouth when you wake up. Notice whether it feels appropriately watery or whether it feels unusually thick and stringy, since texture matters as much as quantity. Pay attention to any unusual taste or smell, particularly anything metallic or unusually strong, and notice whether you can swallow comfortably first thing in the morning without needing water to help the process along. These few seconds of attention each morning build a genuinely useful pattern over time, one you can describe accurately to your doctor rather than a vague sense that your mouth feels dry sometimes. Next, review your medications specifically with this in mind. Put together a complete list of everything you take, prescription and over-the-counter both, since people frequently forget to mention over-the-counter allergy medications or sleep aids when a doctor asks about their medication list. Bring that list to your doctor or pharmacist and specifically ask about your combined anticholinergic burden using that exact term, since it prompts a more thorough review than simply asking whether any single medication causes dry mouth. And I want to say clearly, never stop or adjust any medication on your own based on this video. Medication changes need to happen with your doctor, who can weigh the benefit of the medication against this specific side effect properly. Beyond investigating the cause, there are genuine practical steps to stimulate saliva production in the meantime. Sugar-free gum, specifically containing xylitol, is one of the most effective and accessible options, since the chewing motion itself stimulates saliva glands directly. Sugar-free lozenges work through a similar mechanism for anyone who prefers not to chew gum. There are also specific dry mouth saliva substitute products available at most pharmacies designed to mimic some of saliva's protective properties rather than simply providing plain water. And if you use mouthwash regularly, choose an alcohol-free formula specifically, since alcohol-based mouthwashes can actually worsen dryness rather than helping it. Alongside stimulating saliva, focus on protecting your mouth more broadly while you're addressing the underlying cause. Stay genuinely hydrated throughout the day. Choose water-rich, slightly crunchy foods when you can, like cucumber, celery, or watermelon, which both hydrate and mechanically stimulate saliva production through chewing. Use fluoride toothpaste consistently, since your enamel needs extra support while saliva's natural protection is reduced. And maintain regular dental visits, since your dentist can often spot the early signs of saliva-related damage before you notice any symptoms yourself. One practical environmental change that I recommend often, and that people frequently overlook, is bedroom humidity. A cool mist humidifier in your bedroom, keeping humidity in a range of roughly 30 to 50%, can meaningfully reduce how dry your mouth and airway become simply from the ambient air you're breathing throughout the night, particularly useful if you tend toward any degree of mouth breathing during sleep. And finally, take the specific warning sign combinations we covered seriously enough to actually investigate them, rather than simply managing the dry mouth symptom in isolation. Morning-specific dryness paired with snoring is worth a conversation about a sleep study for sleep apnea. Frequent nighttime urination is worth asking specifically for an A1C test. Dry, gritty eyes alongside dry mouth is worth mentioning Sjogren's syndrome by name to your doctor. A metallic or ammonia-like taste is worth asking about kidney function testing. And leg or foot cramps, particularly on a diuretic, are worth a conversation about your electrolyte levels. Here is the bottom line I want you to walk away with today. Persistent morning dry mouth after 60 should never be automatically dismissed as simply a normal part of getting older. It can absolutely be connected to something as manageable as medication timing or dosage, but it can also be a genuine early signal pointing towards sleep apnea, elevated blood sugar, an autoimmune condition, kidney function concerns, or an electrolyte imbalance, each of which is far easier to address early than after it's progressed further. The real goal isn't simply drinking more water and moving on with your day. It's asking the more important question, why has your saliva production actually decreased in the first place? And then working with your doctor to find that specific answer. If this video changed how you're going to think about your mouth tomorrow morning, take a second and tap that like button. It helps this information reach more people who have been dismissing this exact symptom for years without ever asking why. And tell me in the comments, does your dry mouth show up mainly in the morning? And did any of today's warning sign combinations sound familiar to you? I read every comment, and it shapes exactly what I bring you next. Before you go, if today's video showed you how much your body communicates through symptoms most people ignore, my last video could genuinely save a life, possibly your own or someone you love. It's called 3 Things to Do During a Heart Attack That Could Save Your Life, and it covers the exact practical steps to take in those critical first minutes. Information that takes 10 minutes to learn today and could make the difference in an emergency you hope you never face, but need to be ready for regardless. I'll leave it right here for you. I'm Dr. James Parker. Pay attention to what your body is quietly telling you, and I'll see you in the next one.